a happy, prosperous, and most importantly, a healthy 2021 to you and your family. Welcome to another edition of Wellness Wednesdays with yours truly, Ken Simmons, brought to you by the Northwest Regional Health Authority. Now, for some of you, you may know, others you may not know, the month of January is Cervical Cancer Awareness Month. And in this episode, we're going to be exploring what is cervical cancer. We're going to be chatting with Dr. Quinlan. We're going to be chatting with a cancer survivor and a support group. A lot of information that will help you as we go along this journey in 2021 to be a happier and healthier you, all right? So join us inside another edition of Wellness Wednesdays with yours truly, Ken Simmons.
The month of January is observed as Cervical Cancer Health Awareness Month, where special attention is placed on the prevention and treatment of cervical cancer. Cancer patients can now benefit from critical treatment with the formal opening of the Linear Accelerator Wing at the St. James Medical Complex. The wing was named after one of the longest-serving doctors in the public service, Dr. Hess Benjamin, who is also a specialist medical officer in oncology. To get a better understanding of cervical cancer and its treatment, Wellness Wednesday spoke with Dr. Wayne Quinlan, gynecological oncologist consultant at the Northwest Regional Health Authority, who discussed the various services available to women battling with cervical cancer.
Cervical cancer is where you have abnormal cells on the cervix, which is the first part of the womb, the uterus. And it can manifest in a number of different ways, like abnormal bleeding, and abnormal persistent discharge, bleeding after intercourse, and pelvic pain. Sometimes they have no symptoms at all, and we pick up the cervical cancer incidentally at the time when they're doing their pap smear. We usually pass a speculum, have a look at the cervix, and maybe take some cells or biopsy, treat the discharge, then we take it from there when we get back these results.
Can you list some of the services that you provide in relation to cervical cancer?
Part of the services we provide here is surgical. Now, surgical does not necessarily mean doing a hysterectomy. We do, in terms of the surgical field, we do what we call colposcopies, which is pre-cancer. We can look at pre-cancer lesions or very early stage cancer lesions and treat it with a procedure called a colposcopy, where we basically have a look at the cervix on a high-powered microscope, and we see the bad cells and we can take it off from there. So this is part of our fertility sort of sparing procedures, because sometimes, you know, it's very young women who come in with precancerous or cancerous lesions. So we try to preserve their fertility. We're also blessed with the knowledge of knowing how to do a procedure called a trachelectomy, where we can actually take the entire cervix out and leave the uterus there so a lady could still, in her reproductive years, have children. We also do the radical hysterectomies, which is the procedure well known for treatment of cervical cancer. Just last year, we also did surgeries on women who have completed their family and who are going to have radiotherapy, where we move their ovaries up so that they don't go into menopause. This is a lady in her 30s. So we do that sort of fertility sparing and sort of life sparing procedures in terms of quality of life, where you don't go into menopause when you get your radiotherapy. So that's my aspect of it, and I should point out that not every case of cervical cancer should have treatment surgically. We really reserve surgery for the women who are in the early stage, like 1A1 to stage 2A. After you pass stage 2A, we really leave you to have chemoradiotherapy. We still try to achieve the same sort of cure rates by giving you chemoradiotherapy. A surgery past 2A stage is very difficult. You lose a lot of blood, your morbidity increases. So if we can achieve the same thing with chemoradiotherapy, why not do the less invasive thing? I'm proud to say that I'm a part of an institution where we have a new LINAC, which was provided by the government last year for us. So that's an external beam radiotherapy machine. It gives you high dose radiation to targeted areas to help to treat cervical cancer. They also do brachytherapy, which is a form of radiotherapy as well, but you get lower doses, so less side effects. We also do chemotherapy here. It's not renowned to do chemotherapy for cervical cancer. So it's mainly in the setting of if you had primary treatment before and the disease comes back, or if it's very, very advanced and has progressed past the pelvic area, then you'll get some chemotherapy.
What is the procedure to come into the hospital to access some of these services? What do they need to do?
Well, we are a tertiary center, and tertiary means that by the time you get to us, it means that you have already diagnosed and you're being sent here for definitive treatment. So if you're getting those signs and symptoms, it's always a good idea to visit your local health center or your local general hospital, whether it's Port of Spain or Mount Hope or Sandy Grande. The doctor will assess you there, then they send you to us and we start the definitive treatment. One of the things that we do here that sets us apart from other institutions, we do a multidisciplinary team meeting, which is called an MDT. Every patient is discussed, and the benefit of that worldwide is you get the best possible care when the decision is being made by a group of consultants rather than one person saying you should do this, you should do that. It doesn't happen here, and that's one of the values of working in this institution. A lot of consultants are based here, and we all have a meeting every other Tuesday, and we make the best decision for the patients, and we've seen better outcomes than, say, even 10 years ago.
I also met with a one-year cancer survivor eager to express her satisfaction with the service of the local health facilities in treating cancer patients in Trinidad and Tobago.
My name is Melissa Kramchanz. I am 51 years of age. I am an endometrial cancer survivor, and I have done surgery, done chemo treatment, and still doing radiation, and I am living proof that Trinidad is able to deal with cancer patients. So we don't need to go out of Trinidad to get treatment. So you have to have that faith, that trust in the doctors, in the nurses, and in God. God first, with His help, He will give all the directions to the doctors, nurses, everybody, and make everything a progress.
Having cancer is often one of the most stressful experiences in a person's life, but support groups help many people cope with the emotional aspects of cancer by providing a safe place to share and work through feelings and challenges. In Trinidad and Tobago, one such group is Strong-Minded Survivors.
Sometimes when a person hears cancer without the education after cancer, they think is dead. Cancer is not a death sentence. It is not. We can live long life, normal life with cancer as long as you get your treatment, you put God, you have your support, and you be positive. You can live long. Look at me, 6 years and going. We have cancer survivors in Strong-Minded support group that has 14 years, 12 years, and we are here to support you and your family, give you the education that you need. You do your part, get screening, get testing, be positive, have God in mind, and it all works out nicely.
So as we all heard, cervical cancer is not a death sentence. The key is early detection. Make sure to do your part, and we at the Northwest Regional Health Authority will ensure that you are well taken care of. This has been the actual final episode of Wellness Wednesdays with yours truly, Ken Simmons. So on behalf of the Northwest Regional Health Authority, we want to say thank you for a wonderful 7 weeks, and we look forward to great content right here on NWRHA's Facebook page and Instagram pages. We love you, take care, and have a blessed and healthy 2021.